What is a doctor's weirdest case of a patient accurately self-diagnosing? When I was working the night shift at the ER, this guy walks in around 2 a.m. looking completely normal. No blood, no broken bones, not even limping. He goes up to the front desk and tells the nurse he needs to see a doctor because he has a brain tumor. The nurse looks at him like he's crazy. The guy's maybe 25, wearing a hoodie and jeans, acting totally calm. She asks what his symptoms are, and he just shrugs and says he doesn't really have any yet, but he knows it's there. Now, I've seen hypochondriacs before. People come in convinced they're dying because they Googled their headache, but this guy wasn't panicked or dramatic. He seemed almost bored, like he was picking up his dry cleaning. The nurse told him he'd have to wait since we had actual emergencies to deal with. He sits in the waiting room for 4 hours, not complaining once. Most people would have left or started yelling at the staff. This guy just sat there scrolling his phone, occasionally munching on vending machine chips. When I finally called him back, I figured I'd do a quick exam and send him home with some aspirin. I asked about headaches, vision problems, nausea, nothing. No family history of cancer either. Blood pressure normal, reflexes fine, pupils equal and reactive. I'm thinking this is going to be the easiest patient of my shift. But then, he says something that made me stop writing. He tells me exactly where the tumor is, not just in my head, but the specific location, size, and even what type he thinks it is. He's rattling off medical terms like he went to med school. I ask him if he's in healthcare and he laughs. Says he works at Best Buy selling phones. Never been to college. I'm getting weirder vibes now, so I ask how he knows all this medical stuff. That's when he tells me about his dreams. For the past 3 months, he's been having the same nightmare every night. In the dream, he's lying on an operating table while doctors discuss his brain tumor. They talk about its exact location, how they're gonna remove it, what the recovery will be like. At first, he figured it was just anxiety or too much Netflix medical drama, but the dreams were so detailed and consistent. Same doctors, same conversations, same medical terms he'd never heard before. He started writing down everything he remembered when he woke up. I'm thinking this guy's having some kind of breakdown. But something about how calm and specific he was made me order a CT scan just to cover my bases. The scan comes back an hour later. I'm staring at the images, checking them 3 times because I can't believe what I'm seeing. There it is, exactly where he said it would be. Same size, same type. A slow-growing tumor that wouldn't cause symptoms for months, maybe years. I walk back to his room feeling like I'm in some weird medical TV show. The guy looks up from his phone and asks if I found it. Not, is everything okay, or what are the results? Just a simple, did you find it, like he already knew the answer. When I confirm the diagnosis, he nods and asks about next steps. No shock, no tears, no freaking out. Meanwhile, I'm questioning everything I know about medicine and reality. In 10 years of practice, I'd never seen anything like this. We scheduled him for surgery the following week. The neurosurgeon was just as baffled when I explained how the patient had diagnosed himself. During pre-op, the surgeon asked him about the dreams, and the guy described the upcoming procedure in perfect detail. The surgery went exactly as his dreams predicted. Same approach, same complications, same outcome. The tumor was completely removed, and he made a full recovery. But here's the really weird part. After the surgery, I asked him if the dreams stopped. He said yeah, they ended the night before his CT scan, like his brain knew the message had been delivered and didn't need to keep sending it.